Recording started. We're going to kick it off. Thank you, everyone, for being here for our August 2025 All Hands meeting. Uh, as a reminder to folks, we have a monthly All Hands meeting on the first Monday of the month at 7 p.m. But you know that because you're here today. Um, and as I just said, off recording, but we do record these meetings and we post them to YouTube. So thank you everyone for being here. But if you are unable to make the meetings or you want to get caught up on what we were talking about in a previous month, you can do that on our YouTube channel. And there's also a bunch of other videos there of various different kinds of educational and informative content. So check out what we got. We're building up our video presence by quite a bit. Um, Quick point of introduction, as we always do, Whole Washington is a 501c4 political nonprofit. We're the authors of a proposal called the Washington Health Trust, which is a statewide universal healthcare proposal. Um, we are the largest universal healthcare group in Washington, and our bill is the only universal healthcare bill in the legislature. Um, we're also the only group that's actively building towards a ballot initiative campaign, and we're members of a coalition called Healthcare is a Human Right Washington. So this work is bigger than just us, and we try to coordinate with the activist community of Washington as much as we can, and we sometimes give updates from that coalition. Um, my name's Andre Stackhouse. I'm the executive director of Whole Washington. I live in Seattle near Green Lake. You can always get in touch with me, email on the screen, that cal.com link you can use to set up a meeting with me. And I'm very active on Slack. So if you happen to be in our Slack, that may be one of the best ways to reach me and just collaborate quickly. Um, so starting with some stuff that we got coming up this month. So tomorrow, myself and a member of our advisory board named Annie, who I don't believe is joining us tonight, but we will be in Olympia to participate in what's called an Advocates Roundtable. This is something being hosted by the Universal Healthcare Commission. And so it's an opportunity for us to kind of reach the folks in government who are working on this issue. Um, and it will be a powerful platform for us to say our piece on it. We've presented to the commission before, so it's good to be back in touch. Um, Tomorrow, there will also be an Action Network training with our data team lead, whose name is Lindsay. And my understanding is if you want to join that, you can DM Lindsay on Slack. And we may talk about that a little bit more during the data team update. Uh, on the 7th, we have a comms meeting. So comms and social media are one team, and they have been meeting weekly on Thursdays. So you are welcome to join the comms meeting if you want to get involved. We could use a lot more people on social media as well. And so keep in mind that that's coming up this week, but also weekly for the time being. And if we update the schedule, we'll let you know. We also have a weekly phone bank also on Thursdays. So if you're more of a pick up the phone and make some calls kind of person, you can join the weekly phone bank. Got a couple of events coming up on the 16th in Spokane. And a reminder that I believe it's the first Saturday of the month, but we do have a monthly in-person Spokane meeting as well. On the 19th, we'll be doing another virtual town hall. And then on the 26th, that is our next new volunteer orientation. Those are held on Zoom. So we try to keep busy, and it's great to see some stuff on the calendar. Be sure to check back at wholewashington.org/events often. I don't have a slide for it or anything, but the King County team had a meetup at Stoop Brewing in Capitol Hill, which was great. I got to meet some folks for the first time. And we're going to try to continue to increase our in-person presence out there in the community all over Washington. So keep your eye open for what we got, and there is nothing stopping you from hosting an event yourself. So if there's something that you would like to do and you want Whole Washington support, we can coordinate that together. Some updates from the board of directors. So the board meets on the third Thursday of the month. The next meeting is the 21st. It's on the events calendar. These events are open to the public. And so if you're interested in getting involved in the high level strategy and the decision making that runs Whole Washington, you're empowered to attend. Um, and we always are recruiting to expand the board. So um, I'll be introducing the newest board member soon, but we are still recruiting a treasurer, though we do have a promising applicant. So that position may not be open for too much longer. Um, but we're always recruiting new members onto the advisory board. And if you are on the advisory board for a while, you can become eligible to be a sitting voting member of the board. Um, and you can apply for the board at wholewashington.org/jobs. We have a couple of other positions on there as well. So keep your eye on that page to see if there's a specific position that interests you. Um, Okay, great. So, honored to be introducing Jessa, who has recently, as of the last board member, been voted on as an advisory member. And I threw some stuff from the Jessa's bio onto this slide. We do also have wholewashington.org/leadership, where you can read about everyone else and get their bios as well. But I'd love to hand the floor to Jessa to introduce herself.
Thanks, Andre. Hi, everyone. Jessa, my pronouns are she, her. Love the slide, Andre. Yeah, I'm relatively new to Seattle, been here for a little less than 2 years in the Roosevelt area right now near Green Lake. I work as a cybersecurity engineer for electric utilities is my day job, but I have a lot of background in working and running nonprofits, working on various boards and volunteer-led organizations. So as you can see, I'm involved with a few here in Seattle, some of which have a statewide reach, and just wanted to move from being an attendee at certain events and aspiring volunteer to diving in and getting involved with the work that Whole Washington's trying to accomplish in the next few years. So I'm really pleased to be a new member of the advisory board, and looking forward to seeing what we can accomplish together. So thanks.
Thank you so much, Jessa. Um, And then continuing on board updates, exciting announcement. We actually probably could have announced this last month, but I forgot. Um, but we are very shortly going to be adding a 501(c)(3) to our organization. So technically, this would be a separate organization. Um, but we've been working on this for a long time, and it's a lot of work to maintain a nonprofit. A 501(c)(4) is a political nonprofit. A 501(c)(3) is a charitable nonprofit. Um, but thanks to the folks at Sustainable Seattle, we will be a fiscally hosted C3 under them. So effectively, we will be able to borrow their C3 status, um, and we will be keeping our C4 status. So it doesn't take away from anything that we have. But as a C3, we'll have some new opportunities available to us, including collecting tax-deductible donations, which may result in larger donations. We can participate in employer matching programs like they have at Microsoft, and I'm sure also at Boeing, Amazon, and other large employers in Washington, as well as many, many more grants available to C3s than C4s. So if you're interested in C3 work, you should also get in touch. Thomas is going to be one of the people who is helping us roll that out, but because we'll be fiscally hosted, we don't necessarily need to maintain a full board of directors, but we'll probably be forming something like a steering committee. I do see a hand. Go ahead, Rhonda.
Sorry. Um, Andre, can you explain a little bit more how that works, like to be nested and a separate, like how, so if someone wants to donate, are they still donating to Whole Washington
Hmm.
or can you just a little more detail?
Yes, yes. So fiscal hosting basically means that we the C3 portion of Whole Washington would be a subsidiary of Sustainable Seattle. And so the legal entity is part of Sustainable Seattle. What they will do is they'll supply us with donation links and the infrastructure to collect funds, and those funds will be tax deductible. They'll be to the C3. So while they have, a bunch of organizations that they host and they're their own organization, right? If we collect $10,000 in donations through the C3. That's our $10,000. They will be taking a cut. And so, that's basically what you pay to get the advantage of their infrastructure, including, they're going to be taking care of our taxes and our C3 compliance and all of that stuff. And that really enables us to focus on the organizing side of it rather than the administrative side of it. And we can still collect donations to the C4. Um, there are different rules about what you can spend money on if it's raised through a C3 versus a C4. So C4s, as political nonprofits, can spend effectively an unlimited amount of money on political lobbying and political action. C3s, because they're charities, are supposed to spend an insubstantial amount. They're not strictly prohibited from lobbying, but they're not supposed to spend a substantial amount of their funding on lobbying. So they can do it on things like outreach and community building and education and, frankly, a lot of things that we do. But when it comes to things like, for instance, funding a ballot initiative campaign directly, those funds would tend to come from the C4. So it will, to some extent, complicate, the way that we raise money, because there may be times where we want to raise money through the C4 versus the C3, but it also gives us access to a lot of fundraising that we don't currently have access to. So hopefully it's very additive. And this is all stuff that we'll be learning as we roll this out. Because we are a more political organization than Sustainable Seattle has hosted before, they are taking their time to really help define the details of what this is going to work like, and that's why we're still in a coming soon status on this. But hopefully we'll have more answers on this by next month's board meeting, and we're very much looking forward to the partnership. So hopefully that answers the question, and we can circle back to it. But I think it's a very positive development. So thank you, everyone. I will be giving a quick update on fundraising now. I gave this update in June, and effectively what I'm seeing here month over month is that our fundraising has been a bit flat since the gala. So we've had a very, very strong year in fundraising. It's absolutely blowing away last year's fundraising, but we've kind of hit a baseline of monthly donations. So this month we are down slightly in both individual donations and average donation, down a couple $100 in our total raised, but for the most part, we've maintained our baseline of recurring donations supplemented by some one-time donations. You'll see that the majority of our funding in a normal month is coming from recurring donations. So that means that we have a solid core of supporters who have been sustaining us. And then, the big one-time donations we got earlier in the year and at the gala have really raised our cash on hand, and we're beginning to be able to make use of that money. So I've added this line to the bottom of the slide. We are recruiting fundraising leads and coordinators because we have put in a ton of work over the last couple of months to build more teams and more infrastructure. And we have new leads who have been carrying these teams, and we have all sorts of expanded capacity. But one place that has not really come into place yet is fundraising. We do still have fundraising meetings on the calendar, but we don't really have a core fundraising team that has a core fundraising lead. It's largely been carried by the board, and I do think the board is responsible for some amount of our fundraising, but I think that we want a real independent fundraising team from the board as well. And so we are still looking to build that. And if you happen to be interested in that or know somebody who's interested in that, please get them plugged in. And we have a ton of ideas for how we can roll out a fundraising strategy, but we need the capacity to actually execute, and we're still working on that. So thank you, everyone who has sustained us. We're trying to get better at calls to donation. So I know that a lot of the folks here have probably been recurring donors for a long time or have sent us $10 or $20 at one point or another, but we still have a ton of growth that we need to achieve in order to be able to succeed at our goals. And so if you have it in you to become a donor, to send us a donation, to become a recurring donor, to increase your recurring donation by even a couple of bucks. The money is being put to very good use, and it is building us towards our goals, and it is deeply appreciated. I see a hand from Catherine. Go ahead, Catherine.
Yeah, I just wanted to say, yeah, thank you to everybody who has donated, but fundraising is really, really important. If we are gonna actually get this done, we need to raise funds. So I did want to let you know that we are planning a fall benefit concert, but there's really only 3 of us working on it, and we really, really, really need more help. It's gonna take more people than that. So if anybody would like to help that, it's gonna be up here in the in Arlington. Because that's kind of where the volunteer performers have been, and it's easy, it's convenient for me too. Anyway, so please check it out if it's something that you like to do with helping with concerts and that kind of stuff. It should be fun. It's on September 20th. All right, so mark that, save that date on your calendar.
Thank you. And I believe one of our volunteers who is with us today will be one of the performers. So that is fantastic. And also, I will take the moment to mention that we talked in our postmortem of the gala that we ran this year that around now was when we really wanted to start reconvening the gala committee and begin the planning for next year's gala because it was a huge lift and an early start is going to be the number one thing that makes us pull it off again without going crazy and hopefully bringing in even more money than we did last year. So while we are not yet ready to formally announce the reformation of the gala committee, just be aware that we will probably be um, starting the process of organizing that soon. Especially if you have some experience with event planning or galas, that would be incredibly helpful to get in on early. So thank you, everyone. Your donations are very appreciated. Cool. So if Lindsay or somebody from the data team is here, I would love to hand over the mic. And I don't know how you want to do it. I did throw some. Oh, I guess the order got swapped, but I did throw some of the stats that I saw in Slack onto a slide. Is Lindsay here? I do not see Lindsay, so I'll go ahead and go through these updates very quickly. Um, Data team meets on the first Friday of the month, and it's actually now been consolidated into the data and tech team. So if you are interested in kind of helping with whole Washington technical projects, getting into our digital systems, looking at the data, and helping us use it effectively, please join that team and the monthly meeting. But we have some really huge numbers for July. So nearly 3,000 new pledges. That's something like probably close to a 30% increase from where we were in just the last month alone. Nearly 2,000 new email subscribers. Another 900 mobile subscribers. Some of these may be overlapping, by the way. And then 113 volunteer signups. So huge interest in whole Washington in July. And some of this is reflected in the growth on our social media platforms. And we'll be doing a social media update in just a bit, but this came from the data team. And so you can see that pretty much all of our social media accounts are growing significantly. Huge growth to TikTok. The only one that's been stagnant, it has really been Twitter/X, which we have not been the most active there. But really great to see a strong presence growing on social media as we develop that team. And when we hand it off to the social media team, they'll talk more about ways to get involved. But before we do that, I want to hand it to Rhonda to give a comms team update.
Hey everyone, I am Rhonda Gilligan, and yeah, so I will be kind of leading our comms team. The comms team will kind of oversee the way that we tell our stories out in the public, and here we have as our primary goals to make sure that the website and other media are meeting the needs of our volunteers, right? That you can easily find calendared events or materials that you need in order to disseminate the word, or that you can get questions answered. Um, and that also they bring in new people. So as you guys are all out there promoting Whole Washington, we need to make sure that we can capture that new interest and convert it into action, whether that action is becoming a volunteer or just spreading the word. So, so we're going to be we have meeting every week. It's Thursday at 1:30. You are all invited to come and join us. Make your voices heard if there are ideas that you have, if there are concerns that you have, or if there are needs that you have. That would be the great forum. Of course, you can also message directly to the comms channel on Slack or to me personally. Also, if there's any of you out there who have a background in writing or graphics or photography, or who are interested in developing skills in any of those areas, we would love to have you join the comms team as well. Um, so Andre if we go to the next slide, one of the first efforts that we've taken on in this kind of new collaborative comms team way is to make updates to the banner on the mobile and desktop website. You probably remember we had the gala banner up there, and then after the gala, we went to kind of a generic "Hey, Whole Washington" banner. And now, given the passage of the big bad bill, we wanted to get hard hitting with, hey, this is important. Things are happening and we need to take action. So please join us. No. So that leads to the actions page. You guys have probably seen that page on the site before, but you haven't seen it looking like this. And so this, kudos to Thomas. I think he put this together in less than 15 minutes. And we will continue to iterate all of these things, but you can see the improvement. And so this is what we're looking to do. If you participate in the comms meetings, you can contribute to our priorities. Are there pages on the site that are really not working for you? Have you found, that there's a lack of information? Let us know. Or if you have an idea of how to make this page and others better, we want to hear from you. We want you to participate. And to that end, the last thing that I want to talk about is I set up a channel on Slack called Question of the Month. I kicked it off with a pretty simple question. I'd love for you guys to kind of commit to answering those questions every month. Those are where we're going to learn about you. We're going to learn what excites you, but also what you struggle with, why you're here. And we're going to look to use that information to encourage others to take action as well, but also to get to know each other a little bit better and really start coming together as a real team of people with a common goal. So thank you, and I hope to see a ton of you on Thursday at 1:30.
Thank you so much, Rhonda. And I will just say it has been a real pleasure getting to know you and work with you in this capacity. And we are incredibly lucky to have a pro like Rhonda who is here to share her time and skills on comms, which is just a huge need of any organization like Whole Washington. Um, I'm going to share one additional page before handing it off to social media. So this is a new page on the website. If you go to the header that says Universal Healthcare, you'll find it under there, and the URL is wholewashington.org/polls. But a lot of people are curious about, so what is the public support for universal healthcare in Washington? And in fact, it occurred to me that we needed this page when we were in a meeting with a legislator earlier this year. and they basically stopped us mid-sentence and said, yeah. What's the polling say? And so it's taken us a while to compile this and get it onto a page. But we now have some really good polling information and a really easy way to share it. So this is a lot of the polling is unfortunately a bit older than I'd like it to be, and I think that these numbers have probably all shifted even more strongly in our favor. But let's go through the 3 polls that we really are emphasizing on this page. So this one comes from Northwest Progressive Institute. That's a local Washington State think tank. And they asked back in 2017, effectively, if you support or oppose expanding Medicare to provide universal health coverage to everyone. And you'll see that it's a basically 2-to-1 advantage for support versus oppose. And if you weight it by the strength of that support, it becomes an even stronger blowout there. Only 4% not sure. So we can easily say that Washington State supports universal health care. People say, well, of course everyone supports universal health care, but who actually is willing to pay higher taxes for it? Well, we have polling information on that as well. So this comes from the University of Washington School of Public Health back in 2010. Support for paying higher taxes to ensure health care had a 10% margin over opposition, only 5% neutral. The most recent polling that we have comes from Economic Opportunity Institute. That is another local think tank. And they basically polled Washingtonians on their openness to change. And what we find is that across the political spectrum, Democrat, Republican, Independent, we have huge majorities that first reject the market and private healthcare system. Second, they assert that Washington's healthcare system needs to change. Interesting on this one, 5% more Republicans actually agree to that than even Democrats, 83%. So, we can't say that this is like a Democrat thing. Last, elected leaders and government officials in Washington should take action to reduce healthcare costs above 87 or above 86% in each group. So there is a huge mandate to Washington legislators to take action to address the shortcomings of our healthcare system, and we can show that in polling. So please be empowered to use that out there during your advocacy. And now I'll hand it to Thomas to give us some social media updates.
All right, so a one comms update to start us off, but we actually have a brand strategy coming this month, which is very exciting because we'll actually be able to tell our content creators what we want in each message or how we want things couched, and that's a really important piece of our puzzle. The social media team is recruiting, content creation, boosting, liking, commenting, subscribing. All of this is useful. You do not need to be good at all of these things. Just doing one of these things is incredibly useful to us. Even if it's just logging into your Reddit account and going and upvoting our Reddit posts. Like that's enough by itself. Liking our videos on our TikTok or on our YouTube. And then we have accounts on many different social media platforms, including Facebook, Threads, Instagram, Blue Sky. Oh man, I have to keep track of all these things. TikTok, LinkedIn, X or Twitter, YouTube, and Reddit, where we have our own subreddit, but more eyes come to when we post on r/Washington or r/Seattle or any of the other larger subreddits. And that's it for me. If you want to join, before I go, if you want to join social media, just reach out to me or join our social media channel on Slack. Either of those, I'm happy to meet you one-on-one if you want to talk about how you can contribute. Talked to a couple people today about that, and so I look forward to talking to you.
Thank you very much, Thomas. You're killing it out there. The social media growth is insane, and it is definitely contributing to our growth on all the other metrics. So really excited to see where that stuff goes. Okay, some more updates. Folks may be aware that we have been trying to get a joint committee work session during the interim. So the legislature is out of session right now. They'll reconvene in January. But we have been trying to get them to give us what's called a joint committee work session, which is kind of similar to a hearing, except it would be between the Senate and House committee together. There wouldn't be a vote, so it's more of a work and discussion session. And our hope has been that we would get that by the end of the year so that we would be set up to get a hearing in 2026. We coordinated this request through our coalition, Healthcare as a Human Right, and we gathered a bunch of co-signing organizations, very powerful constituency. We sent them the letter on the 1st of July. We requested a response by the 30th, and it is now several days past that, and I'm sorry to report that we have not yet gotten a response. This is disappointing. Chair Cleveland had responded to our last letter, and we had a verbal confirmation from Chair Bronowski that he was open to giving us this work session. So I went ahead and gave them a call today. I left a voicemail and followed up with an email, and I said, I'm going to be doing an update in our all hands meeting tonight. And if you'd like a last chance to get your word in on where you are on this request, you have to let me know before the meeting. But I did not hear back from them. And so it's my job to report to all of you that they have missed the deadline that we set for them. However, the request still stands. And now that they've missed the deadline, this really gives us permission to ramp up our outreach to their offices. So we've been very nice. We gave them a month. We gathered a bunch of signatures from our coalition. And now is the time to really start to get annoying about it. So we will be ramping up our outreach to them, especially if you are a constituent of either Bronowski or Cleveland. We may be coordinating with you to do some of this outreach. And hopefully you'll hear more about it soon. But I think everyone here should feel empowered to have this on the record, whether you're reaching out to them or you're just talking about it more generally. Just know that this is the latest on this effort, and we will be continuing to fight for this. But we have a more promising update coming out of the State Labor Convention. So this was held at the end of July. It was in Vancouver. I was there. Catherine was there. Because we've been working for about a year now on building labor support, and we had developed this statewide single-payer resolution, and we passed it through a bunch of labor councils throughout the year, and it really was culminating into a vote at the state convention to become a statewide resolution. And I'm very, very proud to report that it passed. It passed with very, very little opposition. In fact, a lot of the opposition was more in the hesitation and would abstain rather than vote against. My understanding is one or maybe a little bit more than one of the delegates voted against it, but there were somewhere between 300 and 350. So the vast, vast, vast majority, like nearly everybody, was voting for this. And we sent out a press release on the 30th. You can read all of our press releases at wholewashington.org/press, so you can get a little bit more info on this. But you can see on this poster here a very powerful constituency of unions, including MLK, Washington Education Association, the Federation of State Employees. We're all co-sponsors of this, and this has been a very, very grassroots effort that we will be continuing to push for labor support. I think it's important that folks know that this was a resolution that pushes the state legislature to develop a state single-payer system and to join a campaign called the Labor Campaign for Single Payer. It is not specifically a resolution in support of the Washington Health Trust, and there are reasons why it was set up that way. Most of the unions seem to be very comfortable with our implementation, but it was easier to get it passed and to get a broad swath of support by not specifically endorsing an implementation. But now that we have this level of support, we have a much stronger platform to build support for the specific implementation. And that's really where we see this labor advocacy moving to next. And that's basically a quick update on the coalition. So we recently held our second in-person retreat as well as a cookout. So we're starting to get better at being a coalition and to meet in person more and to get to know each other and do a lot of deep strategy talks that I think have been missing over the years. There will be another in-person retreat. And by the way, when I say in-person, they are hybrid. So you don't have to attend in person, but the in-person component I think is very powerful. And we're going to do one more this year, at which point I think the plan is for them to become a quarterly. So I think that's going to help us build a stronger coalition to have these regular retreats. And really, it's healthcare as a human right that is probably going to become the staging area for this continued labor engagement. Healthcare as a human right played a huge role in coordinating labor behind this resolution, and we haven't quite figured out what it looks like going forward from here, but it may mean creating a new labor committee. It may mean creating a new organization of some kind, but we're really going to push to not have this be a resolution that passes and then we never hear about it again, and instead be really the beginning of a real labor campaign to push for universal health care. And we hope that they will push on the legislature and that they will be taken more seriously because they are labor and the legislature really has more of a relationship with labor, but also that when the time comes that they will be some of the large organizations that are willing to bankroll an initiative, willing to help us gather signatures, willing to provide staff support. So it's very important we build this relationship with labor, and we are doing a fantastic job. We've come so far on labor. And speaking of coalitions and big picture stuff, sometimes folks ask us, well, what about the national picture, right? Isn't there a Congress? Isn't there national legislation? Aren't there other states? And we are involved in this as well. Obviously, our focus is on Washington State. But we were invited to speak at an organization that you might have heard of or might not, called One Payer States. So when we talk about the sort of national coordination, I would direct you to One Payer States, and that's where you can find information about what's going on in all of the other states that are pushing for single payer. One Payer States is an advocate for Medicare for all federally, but they also are the authors of a bill called the State-Based Universal Healthcare Act, which is not in itself a universal healthcare bill, but what it does is it makes it easier for states like Washington to achieve universal healthcare. So in that sense, it's federal legislation that we're very interested in. So we were very honored to be invited to speak, and actually both myself and Catherine spoke. Catherine was there in person, and I believe we were the final speech as well. And the video will hopefully be available soon for everyone who wasn't able to see it. But the kind of Cliff's Note version that I'll drop for today is that what I really emphasized was we need to build a bigger national movement. That national movement needs to support all of the work that we're doing in the states, and then the states need to turn around and support that national organization. And that's really what it is to be a coalition. So right now, there is no national coalition that is really coordinating and pushing on this together. But I think that where we need to go is to become a coalition so that our efforts in Washington and Oregon and California and New York and Colorado all become mutually supportive, and we can win this in one state, and then we can win it in 5 states, and hopefully one day everyone in the United States has universal health care. So to that end, if that sounds interesting to you, I encourage you to take a look at One Payer States. We have some folks who are on their board of directors. I think One Payer States needs our help to develop into a stronger organization. I would say whole Washington has more resources and seems to be more developed than One Payer States. But there is still a role for us both to play in this movement, and that's something that we will develop together. So just know that there's a lot more going out there. I want to hand it to Raleigh, who will give us a little update on the Universal Healthcare Commission and the Advocates Roundtable happening in Olympia tomorrow.
Hey, what an exciting meeting. I just love participating. Love the momentum. Great work, everybody. Yeah, so I post things on the Slack channel called Team Commission. And if you're not following that yet, feel free to follow it. That's where you find out what's going on with the Universal Healthcare Commission in Olympia and its subcommittee called the FTAC, the Finance and Technical Advisory Committee. And, I think a lot of us had hope that the central position of the commission would really give it a great opportunity to influence state policy, but it hasn't quite stepped up to that yet. So there's a coalition of advocates through Healthcare as a Human Right that's working to push the Healthcare Commission to do the right thing. So we've been giving, and I say we meaning including a lot of you on this call, we've been giving public testimony meeting after meeting, month after month since the commission started, which I think has had a great influence. Andre's also spoken at the commission meetings, but we've never really had a conversation. It's always been one way where we say things. So in response to that, the commission has agreed that tomorrow there's a roundtable, and Andre mentioned this at the beginning of the meeting. And the idea is the roundtable is a chance for a 2-hour conversation between the advocate organizations that are advocating to the commission and the members of the commission. Kind of unprecedented. We don't know how it's going to work out. It's been complicated to plan it. We've been trying to influence the healthcare authority to shape it one way, and it's going to be a little bit different, but I think it's a good start. So the way it's working is that 3 organizations, 3 or 4, including Whole Washington, will have some designated speakers. And Andre and Annie Fitzgerald are the 2 representatives from Whole Washington who will be on the panel. Yay, it's going to be fabulous. All the rest of us who might want to go, we're going to show strength in numbers. There isn't a speaking role for the rest of us at tomorrow's meeting. So I'm going to be there in person. It's also possible to join on Zoom. The information about the location in Olympia is on the Slack channel, Team Commission. It's 626 8th Avenue Southeast in Olympia, but it's on the Slack channel. And also the link for the Zoom meeting if you want to join by Zoom. It's 3 o'clock to 5 o'clock tomorrow afternoon. Really interesting to have this roundtable discussion between 3 advocacy organizations, 3 or 4, and the members of the Universal Healthcare Commission. And I just want to make sure that Andre and Annie, when they're on the panel, know that they have our full support, and that's why I want to go. So great job, folks. The commission meets every month, either the commission or the FTAC, and Andre's slide has some upcoming dates. I always post info about it on the Team Commission channel. Thanks.
Thank you so much, Rally, and thank you so much for being such a great liaison to HUCS, the commission committee, I guess we'll call it, from Healthcare as a Human Right, as well as to the commission directly, and coordinating that at Whole Washington. And as you can see, they do meet every month, so there is always an opportunity to drop in and get a little involved with the commission, and that's honestly the best thing about it. So, and as a quick reminder, we are expecting a report from them on the Washington Health Trust by the end of the year. I'll be prodding them on that at the roundtable.
Amen. Thanks, Andre.
Thank you. Okay, we're getting to the home stretch, everyone, and I want to leave some time for questions. So the Volunteer Coordination Committee met weekly last month. We will not be meeting tomorrow because of the roundtable, but then we'll be meeting weekly for the rest of the month on Tuesdays. And as part of that, we've begun to develop our regional structure. Actually, Lindsay has also been very instrumental in helping us recruit some new regional leads. And there will also be a regional meeting towards the end of the month. You can see it there on the slide. So we're still kind of defining who the regional leads are and what exactly they will be doing. And we have these big aspirations for how we're going to have, coordinators in every county, and everyone's going to know exactly what their job is and all of that. But we're taking baby steps here. You can see that we now actually have coverage in all 7 regions, which is great. A few of these I put a yellow question mark on because either they're a little bit new and may not be fully transitioned into the role, may still be feeling it out, or in some cases, it may be 1 or 2 people who are really kind of volunteering to carry the role, even though they're sort of hoping that we will recruit somebody else into it because they've got enough on their plate. So, the structure is still coming into place, but it's great that, we have the people here for it that we have, and we will continue to build this, and hopefully, once we kind of get these regional leads settled in, we're going to break it down further and start building county teams. And we already have some of those teams, like in Spokane, and starting to form in Seattle. So, there's a sort of order that we're approaching this in, but you are welcome to step in where you see appropriate. And there will be lots of room to discuss that at the Volunteer Coordination Committee meetings, as well as the regional meeting at the end of the month. So stay in touch. Okay, and with that, I wanted to use the rest of the time for questions. Before I hand it off to everyone, one of our volunteers submitted this one in Slack, so I thought I'd take a swing at this to get that sort of question of the month thing going and to kind of start to develop this format. So the question is, given that the federal government plans to decimate funding for Medicare and Medicaid, what is Whole Washington's new plan for how to fund the Washington Health Trust? And I think this is a very important question. So we will be developing, a more concrete answer to this, because the reality is that we wrote the Washington Health Trust before these cuts. We have not rewritten it. And so the current Washington Health Trust, sort of assumed that we would have the Medicaid funding that we are very likely to lose by 2027. And the estimates on how much we stand to lose in state funding is around $4 billion, which sounds like a lot, and it is a lot for the state of Washington. But the Washington Health Trust was already set up to raise at least $20 billion in funding. I don't have the number right here on me, right? But we've always been talking about a significant raise in funding to fund universal health care. And so even though this means that we have to raise more, it is actually it's not a huge increase from what we were already planning to raise. The Washington Health Trust was designed to have a surplus in its funding. And there's a few reasons for that, right? One is that if there's a year where the economy is very strong, you develop a surplus, and then in a year where the economy is weak, you draw from the surplus. And so that surplus, one, can help us cover this margin. And I believe that the estimates that we had were that we had a larger surplus than $4 billion. So in one hand, you can say, well, the trust actually is fine with these cuts. But the surplus becomes lower, and we don't want that surplus to get too low because it's there for a reason. The second most simple option is that we can take the current funding structure, which is available on the website, right? And with fairly modest increases to the revenue streams that we have, we would probably be able to raise the $4 billion to keep things where they are in terms of revenue and surplus. The last thing is that we are always open to revising the funding structure. And while we have put a lot of work in to develop a funding structure that we're very proud of, we've never said that it's the only way to do it and that it's perfect and that there are not more funding streams available to us. And so over the next year and the iterations on the trust across the legislature and the initiative, we'll be able to revisit this. And I think it will be very important that we actually run this past our budding labor coalition, as well as the Healthcare as a Human Right Coalition, to really develop this with the community, even more so than it's already been developed by the community, and come up with a funding plan that we feel very, very confident in. I see two hands. I think what I'm going to do is I'm going to end the recording so that we can get more into our discussion-based part of the meeting. So let me start with that. Recording, stop recording.